I'm Dr. Stuart Menakar. I'm a doctor at the Palo Alto Medical Foundation at the Los Gatos Center. Thanks for joining me today on Health Connections on KCAT TV television, Los Gatos, Monte Sereno. Today we're going to talk about pregnancy with our OBGYN specialist, Dr. Esther Yun. Esther, welcome to the show.
Thank you so much for having me, Stuart.
Great to have you here today. So let's start a little bit about talking about how doctors describe pregnancy in terms of timing. So I know that we think of pregnancy in 3 trimesters. Could you explain to me what that means?
There are roughly 9 months in a pregnancy, so we divide them up into 3 trimesters, 3 months each, and that makes it a little bit easier for us to tell patients what's going to happen during each stage and break it down.
Today we have Dr. Kristen O'Sullivan, who's one of our wonderful pediatric urgent care doctors, who's pregnant. Now Kristen is very close to having her baby, but she agreed to be a model for us in learning about what happens during a pregnancy visit. So I know that what happens at each visit changes a little bit through pregnancy, but could you tell us a little bit about what you and Kristen are doing during your visit today?
So once we get to a stage where the pregnancy is well established, there are a few things that we do at each and every visit to ensure that mom and baby are both doing well. The first thing that will happen when you come in is you'll have a blood pressure check. And we'll check your urine for glucose and protein just to make sure that everything is going well, and also for any signs of infection. After that, we have mom come in, go over any blood work that may have been done. Make sure there aren't any urgent questions or problems that are happening. And then we measure the belly to see how well baby is growing. Take a quick listen to the heart rate, make sure baby sounds well, and then we answer any last questions that mom may have, and that's usually it for the day.
Thank you. Again, Dr. O'Sullivan is in her 3rd trimester of pregnancy, but let's start back at the beginning. So now we know what's in each pregnancy visit. Tell me a little bit about what's happening with the baby and with mom's body during the 1st trimester.
So in the 1st trimester, oftentimes mom will not notice too many changes in how big her belly is, but she will definitely notice other changes. She may notice changes in her appetite, possibly some nausea. Most women do have some fatigue, some breast tenderness, and also may feel like they need to urinate a little bit more frequently. And these are all very normal changes in the 1st trimester for mom. She may or may not experience any weight gain depending on how nauseous she may feel and how much she's able to eat. In terms of the baby, it's just the very beginnings of development. So we have the egg that has now gone into the uterus and is starting to divide, and the very beginnings of a fetus is starting to form. And by the end of the 1st trimester, we can see what looks like an itty-bitty human.
Tell me, you mentioned nausea. What does that have to do with morning sickness? What is morning sickness?
So morning sickness is something that most pregnant women will experience, and it is due to the pregnancy hormones. They can make you feel like you don't want to eat or feel like you have to spit up, which are very common sensations. There are some things that we can do to help with nausea that are non-medical, things like using acupressure C-bands that can help with nausea. Some women find that just chewing on ginger candy or having ginger tea can often help. But if that's not enough, then there are medications that we can use. And there are also some things that we can do in terms of diet, like eating smaller, more frequent meals instead of eating large meals, and avoiding very heavy or spicy foods that can upset the stomach.
Is there any other relief in pregnancy from morning sickness? When does it go away?
So for most women, they find that between 12 and 14 weeks, the morning sickness does ease up.
Great. I think they all look forward to that. So I have a couple other questions about early pregnancy, if I may. We don't want to focus on troubles, but are there any warning signs for which women should seek immediate attention in the 1st trimester of pregnancy?
So we do ask women to call the office as soon as they find out they're pregnant, because we do want to make sure that their pregnancy is established and is normal. And then we will go through some warning signs. And the most common things that we tell people to watch out for are signs of miscarriage, which would be things like cramping or vaginal bleeding. So if you are pregnant and you're experiencing either of these symptoms, I do encourage you to give the doctor a call right away so that you can be seen in the office to evaluate if there's any chance that you might be miscarrying.
Obviously, we hope that every woman is healthy during pregnancy, but that's not always the case. What should women do if they have a cold or the flu?
So it's actually incredibly common for women to get sick during pregnancy. Pregnant women are a little bit more prone to getting the cold or flu because their immune system is suppressed while pregnant. We do recommend that you have a flu vaccine as soon as it's available. It is safe in pregnancy. There are no shown mal-effects of taking the flu vaccine, and actually it's very protective for pregnant women. If you do get sick and have symptoms, I do recommend that you call your physician or speak to them about medications that are safe to take, because there are many over-the-counter medications that you actually can take in pregnancy. But if you wanted to try non-medical measures first, such as saline nasal sprays, using a humidifier, or using some menthol cough drops, those are all safe things to use in pregnancy.
As doctors, we talk to women and men and children about all kinds of sometimes difficult issues. I'm sure that a lot of pregnant women have questions about sex and activity during pregnancy. Tell us a little bit about how you counsel your patients in that regard.
So I do counsel women that they need to be very open with us if they're having any difficulties. It is one of the more difficult things that people come to us with questions about because it is so personal. In general, sex during pregnancy is safe. There are a few conditions in which it can be dangerous, and if that is the case, your doctor will usually inform you. But if you aren't sure, it is always a good idea to speak to your doctor about it. In the first and second trimester, many women will feel pretty normal in terms of intercourse and may actually find it more enjoyable. In the third trimester, it can be a little bit challenging because physically you're a little bit bigger and it can create some physical challenges, but there are definitely some positional modifications and things that women can do to make it more comfortable. Or if it's not something that they're interested in, there are certainly other ways that you can find in connecting with your partner other than intercourse.
And is it important to exercise during pregnancy?
It is incredibly important to exercise during pregnancy, and I can't stress enough how much we do recommend that women get regular exercise. And ACOG, which is our governing body, actually recommends 30 minutes of exercise almost every day of the week. This helps lower your blood sugar, which can help combat diabetes of pregnancy. It can lower your blood pressure. It also keeps you more fit and ready for delivery and can actually make recovery from delivery much quicker.
I'm sure everybody would like that.
Yeah.
Every woman would like that. How about, what are the best exercises a woman can do during pregnancy? And are there any kinds of exercise that women should avoid?
So in general, women who are regular exercisers before pregnancy can actually continue at pretty much their level before pregnancy. There are a few restrictions that we talk to women about. Certainly if there's a problem with your pregnancy that may affect your ability to exercise, such as a heart condition, we may recommend that you slow down or modify your exercise based on that. But most women can exercise 30 minutes of aerobic exercise a day without any complication. We do ask that women refrain from any exercise where they may fall and hit their belly or have any direct trauma to their belly. So no martial arts during pregnancy or full contact sports.
One of the things I always hear from family members, from grandmas, all the folk wisdom about pregnancy is that women are eating for two. Is that true? How should women eat during pregnancy?
So that is a huge misconception, unfortunately, that many people have, is that you're eating for two. Most women actually only need about 300 more calories a day when they're pregnant, which when you think about it, is really just a big snack. So I do recommend that women eat more if they're feeling hungry, but try not to eat for two.
Any kinds of foods women should avoid during pregnancy?
There are definitely some restrictions with food. We do recommend that any dairy products are pasteurized, so no unpasteurized cheese or milk or yogurt. We recommend against any rare meats or raw meats such as sushi or rare steak. All meats should be cooked through. And then we do recommend also that people avoid eating more than 12 ounces of seafood a week just to prevent them from accumulating too much mercury while pregnant.
So it sounds like so far we've talked about a lot of the advice you give to women early in pregnancy at their first few visits. We've talked about what happens at most pregnancy visits throughout pregnancy, and a little bit about what's happening with the baby and the mom during the first trimester. Let's move on to the second trimester of pregnancy, the second 1/3, and talk a little bit about changes for the women in their bodies and how they feel, and a little bit about what's going on with the baby inside.
So second trimester, women will start to feel and sometimes look much more pregnant than the first trimester. So you may find that your belly actually starts to grow and you start to what people call show, which is very common in the second trimester. Women will also find that their breasts will continue to grow as they start to get ready to lactate and provide milk for their babies, and may actually start to experience a few drops of colostrum, which is a yellow fluid that may come from the nipples in preparation for breastfeeding. In terms of the baby, much of the organ development happens in the second trimester, and by the end of the second trimester, most of the organs have formed and are just continuing to develop at that point.
How about in the third trimester?
So in the third trimester is where women usually start to complain of discomfort from the pregnancy. This is where the belly starts to grow so big that it starts to compress on the inner organs. Eating large meals can become very uncomfortable. Some women actually experience some shortness of breath because the belly starts pushing up towards their lungs. And many, many women will experience some low back pain and discomfort because of the weight of the pregnancy on their body. And in terms of the baby, things are continuing to develop and grow, and all the last finishing touches on organ growth and development happen in that third trimester.
How should women take care of their back pain? I know that's a common complaint that I hear when pregnant women come to see me for other things.
So back pain is probably the number one complaint we have from women in the third trimester especially. There are a few things that you can definitely do to increase your comfort. One would be to wear very comfortable shoes. We do recommend some very supportive flat shoes and trying to avoid very high heels because these can stress the back. Using a pregnancy support band can also help relieve some of the discomfort on your back by helping to support your abdominal muscles, which makes the pull of the baby a little bit less. And then making sure that you do take frequent breaks, put your feet up, and try to sleep in a comfortable position as much as possible.
I know that in third trimester, well, I'm not a woman, so I don't know, but I anticipate that every woman in third trimester is waiting anxiously for labor to begin. But also as a doctor, I know that sometimes women have what we call preterm labor or false labor. Could you spend a moment and explain to us what those two terms mean?
So in the third trimester, it's actually incredibly common for women to start to develop some contractions on and off. Most of this time, this is what we call Braxton-Hicks contractions or false labor contractions. And these can be intermittent and last a few minutes to an hour, but generally will go away with some rest and some hydration. When it comes to preterm labor, this can be a much more serious consequence for you and your baby because if you go into labor and the baby's born early, the baby may need special care. So if you're having painful contractions that are lasting for more than an hour and are regular, you do need to call your physician to make sure that you don't need to be evaluated for preterm labor. And if that is the case, we would want you to come into the hospital.
How does a woman know that she's close enough to her due date that she doesn't have to worry about preterm labor, but starts to feel the contractions and knows it's time to go to the hospital to have a baby?
So at 37 weeks, women are considered full term, and at that point, the baby in general is ready for birth and usually does quite well. We usually ask women to wait until their contractions are regular, painful, and persistent. And what I've heard the most probably is the 5-1-1 rule, which is contractions about every 5 minutes, lasting about a minute long for at least an hour before you call your doctor.
Are there other things that might happen to a woman as she goes into labor that would be a reason to go into the hospital even before it's 5-1-1 is reached?
Yes. So sometimes women actually will break their water before they go into labor, and this is actually quite common. So if you're leaking fluid and you think you've broken your water, you do need to call your physician to see if you need to be seen. Bleeding can also occur in the early stages of labor and is quite common in small amounts. But if you have any significant bleeding, then you should call your doctor to make sure it's not at a level where we would want you to come in to be checked. And we also would want to make sure that the baby is moving well. So if you're experiencing a significant decrease in fetal movement or the baby is not moving as much as it normally does, we do want you to call your doctor.
So now the pregnant woman knows that she's reached 5-1-1 with her contractions. Maybe her water's broken. The baby's staying active. It's time to go to the hospital. When's the baby going to come?
Stuart, if I could answer that, I could retire a millionaire. It's very difficult to determine exactly how long a woman's labor will last. But in general, within 24 hours of onset of labor, most people will have their baby.
Esther, you mentioned when you're talking about treatment at home for colds and flus that it's okay to use Tylenol or some other medicines. Why do women need to be careful about using some other medicines?
So there are some medications that can cross the placenta and affect the baby. Some of these are safe, but some of them are not. So we do recommend that if you're taking any medications or herbal supplements, that you run them by the doctor to make sure that they're safe for both you and your baby.
It sounds like pregnant women don't need to worry too much about being able to eat a wide variety of foods. But you mentioned not eating raw fish. I love sushi. Is it okay for women to eat sushi?
It's not safe to eat sushi in pregnancy because it is a raw meat product and can definitely carry some bad bacteria and possibly parasites as well. So we do recommend against eating sushi while pregnant. And we also recommend against eating any cold cuts or sliced cheeses from the deli counter for the same reasons, that they can carry some bacteria that can hurt pregnant women.
You mentioned a lot of foods that aren't so safe to eat during pregnancy. What are the best foods for pregnant women?
So we do recommend that all women do take a prenatal vitamin to make up for any gaps in their diet, especially in the first trimester when they're feeling very nauseated. But in general, we recommend eating a wide variety of fruits and vegetables and lean proteins. And my trick is to shop around the perimeter of the grocery store. So along the walls is where all your fresh whole foods are, and those are the things that you want to be eating the most of. And in the center would be all the processed things with additives such as dyes, preservatives, artificial flavors that we would actually want to avoid while you're pregnant.
Well, I'd like to thank Dr. Esther Yun for being with me today to talk about pregnancy care. Really appreciate it, and I know you do a great job of taking care of all of our patients here at the Palo Alto Medical Foundation OBGYN office. Thank you very much, Esther.
Thank you so much for having me.
As a family doctor, I don't deliver babies in my practice anymore, but I think I can speak for Dr. Yun and for all of our physicians at the Palo Alto Medical Foundation who do deliver babies. Being there during labor and delivery, helping you during your pregnancy, is one of the most amazing honors that we can have as doctors. Being privileged to take the first look in your newborn baby's eyes, the first to hold them, that's just an amazing feeling. So all of us here at Palo Alto Medical Foundation want to thank you for allowing us into this very important part of your lives. And we hope that today's session has given you just a little bit of information about what you might expect during pregnancy. Maybe another time we'll talk more about labor and delivery, and we certainly are going to talk about infant care. But that's all for today. Thank you.